So a real quick one on a study that came out in January this year, 2024, and I think I'm saying this right, but Takase, Takase, and they looked at the protective effects of extracorporeal shockwave therapy on the degenerated meniscus in a rat model. Now just consider this, that most of the things we now know and have good science for in humans originated in a rat model. So whilst we don't have too many human studies, there are some. This is really interesting. And what they did is they had a normal rat knee, they resected the ACL and then waited a number of weeks till the meniscus started to degrade, but didn't touch it with shockwave. And immediately they resected another group of rats' knees. Then they started using shockwave. So does shockwave protect after the ACL has been snapped? And the findings are that it does. In fact, the meniscal histopathological score at 4 weeks after anterior cruciate ligament tear, if you like, was significantly higher than that in the group that obviously had no ACL cut. And the score in the shockwave group, the group that had shockwave the minute that the ACL was gone, was significantly lower than that in the group that didn't have shockwave, and at 4 and 12 weeks after shockwave as well. So they did some really in-depth tests, and in the group that had shockwave showed a great expression of mRNA, the CTGF and CCN2, and that was increased 24 hours after they had shockwave. Basically, what this study tells us is that shockwave might suppress the induced meniscal degeneration by stimulating the cartilage repair factors and inducing collagen type 2. So just think about this. You rupture your ACL, if immediately you get into having shockwave done on you, there's a chance that you will save the meniscus cartilage rather than having that degrade because of the issues with stability of the knee. Now, what about people that have cartilage tears anyway? Surely this points to the fact that we can start to use shockwave on cartilage tears, because let's be honest, no one's really operating on them anymore unless the person's in loads of pain or they've got a fixed flexion deformity. So it's rats, but eventually will be humans if you want to take my belief pattern here. And it's shown that we can actually do something to the meniscus which is frankly protecting the cartilage and stimulating those repair factors and inducing collagen type 2. So there we have it. Not exact facts for the human, but something to think about when your next patient comes in with a cartilage problem. Stay lucky.